To health news now, a new study shows obesity rates in the U.S. appear to be plateauing and possibly even declining. It's the first time the JAMA study hasn't shown an increase. Now experts are crediting a number of factors, including the increased popularity of drugs used for weight loss like Ozempic. Let's bring in Benjamin Rader, who led this JAMA study and is an epidemiologist at Boston Children's Hospital and an assistant professor at Harvard Medical School. Benjamin, thank you for joining us. We appreciate it.
Hey, thanks for having me, Whit.
I've
been in public health for a long time, and there's just been this dominant narrative that every year obesity gets worse and worse and worse, almost like it's this accepted fact. And, we've also heard about GLPs and how people are experiencing pretty dramatic weight loss. My co-authors and I wanted to study, is this individual behavior actually translating to weight loss at a population level? And we gathered 16 million people, over 47 million records, and we found, sure enough, there's been this change of pattern. There's been this decline for the first time in decades.
And tell us more about that pattern, right? And why this data is so significant now.
Yeah, when you look at the top 10 causes of death in the United States, every single one of them, obesity is a risk factor and makes each of those things worse. So we've been trending up and up and up. Well, the result is that each one of these factors gets worse and worse and worse. So this bucking of the trend, this change, is great news because it means, we're going in a direction where we're going to have better health outcomes as a country.
And what do you think, or I guess, what does the survey show about some of the contributing factors to this change in obesity rates? Why are they declining or perhaps plateauing now for the first time in a decade or so?
Yeah, so as a country, we've changed a lot in the last few years as we have emerged from the pandemic. People are going back to their pre-pandemic lifestyles. But what we saw is that in places where they were experiencing the biggest drop in weight loss, they also had the highest amount of GLP-1 prescriptions filled. So this gives us some evidence that, these drugs are playing a big role in this change in pattern that we're seeing.
And speaking of that, so this recent Kaiser Family Foundation survey shows about 12% of U.S. adults say they have tried GLP-1s in the past. 6% say they're currently using them. What's the impact of this trend if it continues not only on obesity rates, but on the use of drugs like Ozempic and Wegovy?
Yeah, so these drugs have side effects. And so even though that 12% of the country have tried them, only 6% are still remaining on them. But the idea is that, this is the first generation of these drugs. There's going to be other generations with reduced side effects. 6% is a huge percent of the population. It's 30 to 40% of the population is obese. As this uptake in drugs continues, hopefully that translates to a continued reduction in obesity across the country.
Well, it's a fascinating survey. And Benjamin, thank you so much for taking the time to share your findings.
Thanks so much for having me, Whit.